My name is Chung Lim. I'm a consultant vascular surgeon at the Royal Free Hospital. Vascular malformation is a congenital condition that affects the formation of the blood vessels, and it affects all types of blood vessels, including the artery, veins, capillaries, as well as the lymphatic system. Patients with vascular malformation suffers from a variety of symptoms, including pain, organ failure, overgrowth of organ, formation of blood clots, as well as occasionally they may affect the heart, causing heart failure. The mechanisms of vascular malformation remains unclear, and the blood flow in the vascular malformations is very heterogeneous and very unpredictable. Therefore, it is very difficult for the clinicians to predict or to formulate a treatment for vascular malformation. It is important that we work with the engineers, because the engineers will be able to help us to understand the blood flow in the vascular malformations. Understanding the blood flow in the vascular malformation helps us to predict and identify areas of the vascular malformation that we can occlude or operate on in order to shut down the blood flow, or at least to slow down the blood flow in the vascular malformation. I'm now going to hand over to Vanessa to discuss the technical side of this interesting project on vascular malformation.
My name is Vanessa Diaz and I'm from Mechanical Engineering at UCL. We have been discussing what sort of engineering tools might be helpful to clinicians to tackle this problem, and one of the tools of choice is, of course, doing simulations, so we can actually do predictions on the blood flow. If you have this intricate network of vessels, we can take the images from each patient, put the appropriate boundary conditions, and then do blood flow simulations so we know where the flow is coming from and where it's going. And that will give them really good information about where to put those needles, where to put those coils. The other thing that we can do is to use virtual reality or augmented reality, or both, to actually help them to look into the malformation. Malformations are such intricate networks of vessels that it's really difficult for them to see where really the arterial side and the venous side are, and where both meet, where the flow is going. So if you can have tools that enables them to look into the vessels, to zoom out, to go around the vessels, it would be so much better than the tools that they have now. Right now they look at radiological images, so it's 2D. We can immerse them in this environment and actually allow them to see the problem as if they were there inside the vessel. And I think that would be a fantastic tool for them to explore the different treatment strategies that they have. UCL is a fantastic place to do this project for two reasons. The first of all is that there is actually not a lot done, if anything at all, on malformations from an engineering side, and we have the tools and the capabilities to actually tackle this problem. But the second one is that the Royal Free, which are our closest collaborators, at least for my group, they are developing this fantastic center for the treatment of malformations. They have patients from all over the country that come. We'll have a selection of patients, and we actually might be able to make a difference because they come from everywhere.